So hello friends, welcome back to my YouTube channel. Today I'll be discussing a topic on operative surgery, that is some important surgical incisions. So I'll be discussing some major surgical incisions that are usually done during a surgical process. So I'll be starting with the upper midline incision. So upper midline incision, it always begins from the Giphisternum to the umbilicus and it runs along the midline. So here in the dotted line you are looking the incision. So this is the upper midline incision. So basically it is used for the repair of the perforation of the gastric and the duodenal ulcer. It is also used in the vagotomy and pyloroplasty. It is also used for the gastrojejunostomy and left hepatic lobectomy. Sometimes when there is the splenic rupture or traumatic injury to the spleen, or splenectomy is required for any condition, then we can use the upper midline incision as well. And it is also used for operation on the transverse colon, abdominal aorta, or the inferior vena cava. So this is all about the upper midline incision. So the next incision we'll be discussing is the lower midline incision. So the extension of the lower midline incision is from the umbilicus to the symphysis pubis. So this would be running from the umbilicus to the Giphisternum here. So basically what are the surgeries that are done by using the lower midline incision? These are the surgeries on the urinary bladder, such as suprapubic cystostomy, suprapubic cystolithotomy, cystectomy, and on the prostate we can do the prostatectomy, and some gynecological operations such as cesarean section, tubectomy, abdominal hysterectomy, or the operations on the ovary or removal of the ovarian tumors or chocolate cyst. This can be done from the lower midline incision. And on the intestine we can operate on the sigmoid colon, that is volvulus operation, or operation of the right iliac fossa, that is the operation of the breast appendix, or repair of the ileal if there is any ileal perforation. So we can repair it from the lower midline incision. So this is all about the lower midline incision. Now I'll be discussing on the upper paramedian incision. So where is the upper paramedian incision done? It is usually done, it can be done on right or the left side. So if it is done on the right side, it would be called the right paramedian incision. It runs again from the Giphisternum to the umbilicus, just lateral to the midline. So it can be either right or left paramedian incision. So what are the surgeries that are done on with the help of the paramedian incisions? On the right side, what we do is we repair the perforation on the duodenum, and we also repair the gastric ulcer perforation, duodenal ulcer perforation. Cholecystectomy is also done. Usually this is not done, this incision is not done for the cholecystectomy. We will be discussing on that. It is also done for the Whipple surgery. This is very important, that is pancreatico-duodenectomy. This is the Whipple surgery. It is usually done on the upper paramedian incision. So this is all about the right upper paramedian incision. Then on the left upper paramedian incision, what surgeries are usually done is the vagotomy and the gastrojejunostomy, and splenectomy and left hemicolectomy. These all surgeries are done by the help of this left paramedian incision. So now let's proceed to the next incision, that is the lower paramedian incision. Lower paramedian incision, this can again be on the both side. It can be on the right side, it can be on the left side. So what surgeries are done on the right paramedian incision are the repair of the ileal perforation. Since iliac fossa lies on the right side, right iliac fossa, we can do the surgeries for the repair of the ileal perforation, appendicectomy, or cystolithotomy, ureterolithotomy on the right side. It can also be done, and also removal of the ovarian tumor on the right side. And some gynecological surgery such as cesarean section, as I have told you, on the lower midline incision. The same surgeries can be done by the lower paramedian incisions as well. And on the left side, what we can do is, very importantly, rectal carcinoma, the surgery for the rectal carcinoma, that is the abdominoperineal resection, and also on the operation on the left ovary and the fallopian tube. This is all about the lower left and right paramedian incision. Now I will be discussing a very important one, that is the subcostal incision, also known as Kocher's incision. It extends 10 centimeter, that is 2.5 centimeter below the right subcostal area just 2.5 centimeter below and parallel to it. That means this is the, if this is the right subcostal margin, then it would be 2 centimeter below and it would be parallel. This is the incision, and I'll be changing the color for it. So this red one will be the subcostal margin, and the pinkish one will be the incision. So this incision is also known as Kocher's incision. So it is basically used for the cholecystectomy or choledocholithotomy or choledochotomy or right hepatic lobectomy. Basically, hepatobiliary surgery are usually done by using the Kocher's incision or the subcostal incision. So finally, we are going to the next one, that is the phalansteal incision. The phalansteal incision, this is very useful in gynecological or obstetric surgery. So this is the umbilicus, and here it is the pubic symphysis. So in between this incision is given. This is called the phalansteal incision. This is usually done for the cesarean section, most commonly cesarean section. Other than cesarean section, it is also done for the operations of the urinary bladder, and also for the prostate, and also for the abdominal hysterectomy, and operation on the ovaries in the fallopian tube. And finally, very important one and very common, we'll be talking on the incision for the surgery of the appendicitis. For the appendicitis, see, if this is the anterior superior iliac spine on the right side, and this is the umbilicus, then there will be a line that would be joining to anterior superior iliac spine and the umbilicus. Then a perpendicular line is drawn here. See the dotted line, the perpendicular line, and this will extend 1/3 of this line, just 1/3 above and 1/3 below, and this incision would be called the gridiron incision, and this is the incision from which the appendicectomy is usually performed. That means I'll be erasing this one and I'll be drawing it once more, and this would be the gridiron incision here. So this would be perpendicular to the line joining the anterior superior iliac spine and the umbilicus. So this lies at the McBurney's point. So this is perpendicular to the line joining the anterior superior iliac spine and the umbilicus, and appendicectomy is usually performed here. And one fancy incision is also given, that is called the Mercedes-Benz incision. So you have seen the logo of Mercedes-Benz. So I am drawing this one, and this incision is called the Mercedes-Benz incision. So if there is any thoracic pathology along with the abdominal pathology, then if exploration is required, then this Mercedes-Benz incision can also be done. So, and we can also do the incision here on the inguinal region. So incision is given usually just 1.25 centimeter above the inguinal ligament. So this is usually done for the hernia repair and all those things. So these are the basic incisions that are usually practiced in surgical operations. So if you feel my videos are helpful, please subscribe to my channel, and please comment how are the videos, and I'll be improving in next videos. Thank you for watching my videos.